Let's talk about miscarriage. Miscarriage, also known as spontaneous abortion, is the loss of a pregnancy before the 24th week of gestation, or when the fetus weighs less than 500 grams. Miscarriages are relatively common, occurring in about 10 to 20% of known pregnancies. It's a distressing experience for individuals and couples who were eagerly anticipating the birth of a child. Miscarriages can be classified into several types based on the timing and the circumstances of the loss. And they include number one, a threatened miscarriage. In threatened miscarriages, vaginal bleeding occurs. However, the cervix remains closed and the pregnancy may continue without further complications. Number two is an inevitable miscarriage where there's vaginal bleeding and cramping and the cervix begins to dilate, indicating that the miscarriage is likely to happen. Number three is an incomplete miscarriage, and in this case, pregnancy tissue is expelled, but some still remains in the uterus, and they may require medical intervention for removal. And number four is a complete miscarriage, where all the pregnancy tissue is expelled from the uterus without a medical intervention. Number five is a missed miscarriage or missed abortion. And here the embryo of the fetus has died, but no symptoms of miscarriage has occurred. This type is also often discovered during a routine ultrasound scan. Various factors can contribute to a miscarriage, and they include chromosomal anomalies in the fetus or the embryo, maternal age above 35 years, hormonal imbalance, uterine abnormalities, viral and bacterial infections, chronic health conditions such as diabetes mellitus or thyroid disorders, immunological factors, and lifestyle factors such as smoking and consumption of excessive alcohol. Environmental factors such as exposure to toxins and radiations could also lead to miscarriages. Miscarriages often present with symptoms, and these symptoms include vaginal bleeding, which may range from light spotting to heavy blood flow, abdominal cramping or pains, which may be mild to severe, passage of tissue or clots via the vagina, decrease or cessation of pregnancy symptoms such as breast tenderness or nausea, back pain, fluid or tissue passing from the vagina. It's important to note that not all bleeding or pain during pregnancy indicates a miscarriage, as some of these symptoms could be perfectly normal. However, any concerns should be promptly discussed with a healthcare provider. To diagnose a miscarriage, healthcare providers may use several methods, and this includes a pelvic examination. In this case, a physical examination to check for signs of bleeding, pains or abnormalities in the uterus and cervix is done. An ultrasound scan can also help confirm the presence or absence of a viable pregnancy, assess fetal development, and detect any abnormalities. Blood tests such as serial measurements of the human chorionic gonadotrophin levels can help us determine whether a pregnancy is progressing or being terminated. The appropriate treatment for a miscarriage depends on several factors, including the gestational age of the fetus, the type of miscarriage, and individual circumstances. Treatment options include, number one is the expectant management. In some cases, the body naturally expels the pregnancy tissue without medical intervention. Hence, we just monitor the progress and provide supportive care for the woman. Number two, the use of medications. In certain circumstances or situations, medications may be prescribed to help the uterus expel the pregnancy tissue. And finally, on number three, surgical procedures. Here, dilatation and curettage may be carried out, or a vacuum aspiration may be performed to remove the remaining pregnancy tissue from the uterus, if necessary. Experiencing a miscarriage can have profound emotional impact on individuals and couples. Grief, sadness, guilt, and a range of other emotions are common. It's essential to allow oneself to grieve and seek support from loved ones, friends, or support groups. Counseling or therapy can also provide valuable emotional support during this challenging time. After a miscarriage, the body goes through a process of physical recovery. This includes managing any discomfort or pain, monitoring bleeding, and ensuring the uterus returns to its pre-pregnancy state. Follow-up care may involve regular checkups to assess recovery and address any concerns and complications. Let's discuss recurrent miscarriages. Recurrent miscarriages are defined as 3 or more consecutive pregnancy losses, and this can be emotionally and physically challenging. Further investigations may be recommended to identify underlying causes such as genetic, hormonal factors, uterine abnormalities, or autoimmune disorders. There are numerous resources available for individuals and couples who have experienced a miscarriage, and they include, number 1, support groups. Connecting with others who have had similar experiences can provide comfort and understanding for clients. Number 2, counseling or therapy. Professional support can help individuals and couples navigate through the emotional impact of miscarriage. Online communities and forums could also provide space for sharing experiences, seeking advice, and finding support. Medical professionals can offer guidance, answer questions, and provide appropriate care during the recovery process. A miscarriage is a heartbreaking experience that affects many individuals and couples. Understanding the causes, symptoms, diagnosis, treatment options, and emotional impacts can help individuals cope with the loss and seek the necessary support. It's important to remember that each person's experience is unique, and finding compassionate care and support is crucial during this challenging time.